think, this few minutes now we have will be very less to learn. But with that, I would like to move to Srinivas. You had been doing a lot of great work supporting all these healthcare units to remain in an environment where people are staying connected, the communication, the brand, many aspects I found you had been doing, and we are eager to learn more from you, Srinivas. So over to you. Please share your thought leadership.
Hi, my name is Shrinivas Ayyar. Good evening to all of you. A big thank you to Rahul, Chandan, Yash for reaching out to us. A big hello to all the panelists who've been sharing some fantastic insights. And I see a nice audience of more than 50 people attending this. And I'm sure they're going to watch this later on with the recording. So a lot is being said about HR, and I think when we look at, I'm going to talk about artificial intelligence, machine learning, design thinking, and I think there's a great opportunity for people to join this revolution. When we think about artificial intelligence, most people can be divided into two groups. One, who think that AI and ML is the ultimate solution for humanity. And the other who thinks that artificial intelligence is the worst enemy that humanity has created for itself. And so there is this great cusp of an opportunity for people to get into deeper into these areas. We've started an initiative called the Edusattva, where we trained people on design thinking and also artificial intelligence, machine learning, edge computing, and so on. The idea is to help professionals and businesses understand and deploy design thinking and AI ML to empower them to solve mission-critical problems, to innovate and to grow. So let me give you a few components about artificial intelligence. We know that it's a big word, it's a big buzzword. IBM Watson diagnoses heart diseases better than cardiologists do, right? We know that chatbots in London are dispensing medical advice as good as some of the finest nurses. Smartphone apps are detecting skin cancer, and algorithms are diagnosing eye diseases better than some of the ophthalmologists. So the question is, with so much of going for AI, are patients trusting AI? And the answer is a big no. And the reason is that it's simple. Every patient believes that he is unique. He's not a stat. He's not an algorithm based. So that's one of the key components. So patients are not trusting. So there is a great need to tell them that every patient, when we are deploying artificial intelligence, we are talking about taking their personal data and using that to come out with the right level of medical solutions. Now that's from the patient point of view. Let's look at it from a doctor's point of view, and find out if doctors believe that AI is going to be great. Some of the forecasts are 90% of hospital routine is going to replace what 80% of doctors do. So there is again a certain level of distrust on what is AI going to replace. And I'm going to talk about three areas where doctors play a key role. One is prevention and the wellness industry. Second is diagnosis, and the third is treatment. And so when it comes to prevention and diagnosis, we see a huge opportunity for AI ML to play a role, because this is all about using data, crunching numbers, and coming out with actual things. But when it comes to treatment, it's the doctors who play a major role. So which means there is this great opportunity for doctors to use AI ML and also communicate it to patients. That data can be crunched beautifully in their favor to deliver better treatment protocols. That's as far as the AI is concerned. Let's come to design thinking. So we're working with a group of architects who look at how can they use highly localized material. How can they bring nature inside hospitals? They call it the lens. They call the formula as lens, and they are working extensively with hospitals. Now, that's the big idea. Can we have beautiful sunshine coming into hospital rooms? There is also this opportunity where shared ICU is now being converted to private ICU in such a way, and the result is that there is 50% reduction in hospital infections. So all these can play a great role, and that's the wonderful opportunity. And then we need loads of talented people to get into it and interpret this effectively.
I'm tempted to go to Farhad, but I have a very interesting question from Archie Saraf. And on this, I would like both Shrinivas and Farhad to comment one by one. This is on how technology and design thinking can work together in industry. So
Okay.
who would go first?
I think it is design. Yeah, please speak, no problem.
All right, that's a great question. Both these can normally work parallelly, right? For example, we were talking about the idea of decreasing hospital infection. So artificial intelligence is what is going to throw us data on what is to be done. And design thinking takes a cue from there and say, how do we do it? So both the what, the strategy part, and the how, the tactical part, can be solved by creating this beautiful cusp between artificial intelligence and design thinking. I must talk to you about what happened with the Boston Hospital. And these guys were one of the biggest problems from a patient's perspective, as far as hospitals is concerned, is to the patient discharge on time. This is a pain point both for the patients and the stakeholders within the hospital. And this is where this Boston Hospital used big data, artificial intelligence to ensure that patients get home at the right time, very comfortably. And the entire hospital design made it easy for them to feel really good about going out of the hospital and having great memories. So it's a wonderful thing for technology and the science part of it, and the art to sort of collaborate and deliver efficiencies and results.
Thank you. I'm tempted to go to this, in this case, demand side at HR from business, but I will hold on to my, curiosity, because an excellent question has come up from Dr. M. Wasim Ghori. And this question is, what will be the role of empathy and intuition in healthcare delivery, given the digital transformation of healthcare ecosystem? Beautiful question. And I'll go to Shrinivas, and I know all of you would like to answer. So Shrinivas, first from you, and let's see whether we have time to get response from everyone.
All right, that's truly an amazing question. Yeah. So I was talking about the architectural team, which is working on hospitals, right? And they have a process called lens, and the E of lens, it is LENS. The E for lens is empathy, to understand stuff from the patient's shoes, and that's a very important thing from a hospital perspective, because when a patient or a patient attendant is entering the hospital, he is actually entering a world which is very confusing, where he is deeply stressed out. He's got major problems, and that's where there is a great opportunity for technology to throw in the apps, the trends, and the doctor's own intuition. In fact, we work with a very, very popular, very famous orthopedician, and who believes that a great amount of care can be delivered with human touch. So he encourages his own doctors and team to touch patients, hold them so that they feel a lot more comfortable. In fact, there's a brilliant book written by Walter Lee, which says that what would Walt Disney do if they were to run hospitals? Obviously, they would create magic using empathy, intuition, and delivering an enormous amount of care to patients.
I was so eager to get your, last few parting comments. I guess if you can use one line as a inspiration to our audience, because today's session is one of the most vibrant and very high level of learning in my capacity of a moderator and a speaker in webinars. I think I'm very thankful to all four of you. Thank you for such a beautiful time you gave us, so much learning. So I'm actually requesting I might move to a little more than 6:30. First time I'm breaking the rule, just because we have an excellent speaker. One line, please. Shrinivas.
Yeah, so artificial intelligence, design thinking, these are buzzwords, but they're a black box. And I like this line by Tony Robbins, who said, whenever you see confusion, get excited, because there are opportunities. And the opportunities are great because we can create human-centered solutions at scale. And that's a fantastic way of reaching out and helping mankind.